Come in. I have to tell you, the throwing away of the mask, being in private business, the throwing away of the mask right away, they're thrown away. And when you hear 55 million masks, well, what I'm saying, 55 million, how could it possibly be such a number? They say, oh, that's just a small fraction of what we need. And I said, why aren't we sanitizing masks? You know, you look at the masks, I've looked at all the different masks. Some don't lend themselves to doing that, I think, but many do. And I said, why aren't we have very good liquids for doing this, sanitizing the masks. And that's something they're starting to do more and more, they're sanitizing the masks. And I don't know if anybody would like to speak to that.
Yeah, there are some CDC guidances about how you can minimize the use of masks, different things that you could do with testing, and when you have masks, how you might reuse them, which ones you can reuse them.
Solution to this other than buying more masks? Everybody need to change how they're using them?
Yeah, well, there are a couple of things. One, for example, we are moving towards getting testing where you don't have to have PPE. I mean, I'm not going to tell you the day is going to be there, but it's going to be a swab that you can stick in the nose of the person who is either infected or not, but that person doesn't need PPE, the person who's administering the test. So if you could do a self-administered test, stick it in a vial, hand it over. You don't need a mask, you don't need PPE. That's one of the things we're trying to do.
I would have liked that much better. Personally,
Dr. Anthony Fauci, you're listening to special coverage from NPR News of the coronavirus task force hearing. Scott Simon here with Ron Elving and with Joe Palca. Let me turn to you gentlemen, if we could, to try and winnow through the hard news that we heard. And in fact, let's hear a clip from early on in the president's presentation.
every American has a role to play in defending our nation from this invisible, horrible enemy. It really is. It's an invisible enemy. And we will be successful, very successful, hopefully very much sooner than people would even think. So we say stay at home and save lives.
Joe Palca, we have been trying to determine, and I believe we have, that this is the first time the president has said this bluntly, stay home.
Yeah, I haven't. I've gone back through the transcripts. Usually when he says stay home, he says stay home if you're sick. Whether he left that out or whether he meant to make this
Well, he amplified later in his remarks. He did say, in further remarks, he said stay away, don't work, which would seem to ratify the notion that he's saying stay home to America.
Yeah, well, it certainly sounds like that. I mean, he could have, he can say it more clearly if he wants to. I think we're still trying to parse this out of some of the comments he made, but yes, it seems to be a slight shift.
Brian Elvin, what did you notice from these remarks today?
My general sense is that the president, beginning on Friday the 13th, March 13th, when he declared the national emergency, has been taking a step each day, maybe a half step some days, maybe a little more than a step some days, but a little bit more of a step each day towards treating all of this as seriously as some people have been urging him to do for a number of weeks now. He keeps moving in that direction, but he keeps hesitating and saying things like, well, I think we're going to get past it and we're going to have a huge celebration, and I think it's going to be a lot sooner than some people think. So he will say that, and then he will turn around and tell people not to go to work, and he does not tell people how long they're going to have to stay home, but he does throw out these bright prospects for some imagined future. Doesn't say when and doesn't say why he thinks it's going to happen that way, but he wants to keep working that in because he does not want to be entirely downbeat about it. And this has been a real process of dragging him along, and you watch those people on the stage with him, watch their body language, watch how they defer to him, watch how they are trying very carefully to bring him along.
Joe Palca, back to you if we could. The president and other people on the podium seem to indicate that there was great progress being made, both in having private manufacturers step forward and manufacturing of surgical masks or masks to be used in hospitals, and the availability of testing.
Yes, clearly they were at some pains to show a graph that showed what looked to me like a very dramatic increase to 50,000 in the last 24 to 48 hours of tests being administered, and those were tests where the results had been reported. Yes, there's no question that there are now multiple private companies offering the tests. State labs are offering the tests. CDC is also still offering the tests, and hospitals, many hospitals have the ability to offer the test. That's good, and it will be certainly relevant to an individual patient who needs to find out whether he or she has the illness or not, this particular illness. But the question is that the volume of tests that will allow you to make statements about the course of the epidemic and who's getting sick? Clearly, they're still saying if you only should take this test if you're ill. So there's still questions about that, but the testing is maybe I don't know. I don't want to say it's not a false question because it's a very important question, but really it's what are you going to do with the results of that testing? And these steps, as Ron was saying, toward a more active role for the American people seems to be what's coming out.
Because you can't really tell what progress you're making until you have considerable tests administered and the results.
Sounds like it.
I also want to add, we've gotten word that my colleague, Wilbur Garcia Navarro, interviewed the mayor of Miami, Francis Suarez, and he said whatever representation was just made in the White House briefing room, tests are still limited, and Mayor Suarez said they have had, quote, zero COVID-19.
Right. Well, I think you'll remember that early on they were saying anybody who wants a test can get one. Clearly that's not the case.
KPBO HD Calexico. Good morning from the traffic center. One accident, one out on the East 20. West 8 at Crestwood. This vehicle is going well off the freeway into an embankment and crews around that scene. Crestwood, the freeway is good. Traffic times are from downward Oceanside. It is 23 minutes. The radio programs that you love and you cover Legacy support KPBS through one trust or retirement plan. You can go to kpbs.org/plan-giving for more. Look at your salary drive. I'm Mark Seaman for KPBS. Where news matters.
I'm Sam Sanders. It's been a minute. This week on the show, no panel, no roundup of the week's news. Instead, we're giving you a social distancing survival guide. Two chefs give us advice on how to cook right now, when store shelves might be bare, and when you aren't quite sure when you'll leave the house next.
There are a whole bunch of cheeses that you can freeze.
You can freeze cheese?
No, I swear, I promise.
A comedian tells us what she's doing with all this newfound free time.
I cleaned out, I got rid of a bunch of bras. I took the bras.
And a psychologist tells us how to reframe social distancing.
Our job is to be physically distant, but that doesn't mean being socially isolated. In fact, I think that we should start a new term called distant socializing, putting in a good amount of time every day to just connect with other people.
Stay with us. More after these headlines.
Live from NPR News in Washington, I'm Barbara Klein. President Trump is lauding states, localities, private businesses, and individuals for their steps to combat the spread of the coronavirus. At a White House briefing today, the president says everyone has a role to play.
So we say stay at home and save lives. It's a time of shared national sacrifice, but it's also a time to treasure our loved ones and to take stock of what is most important, our faith, our families, our neighbors, and our great country.
The president reiterated the steps his administration is taking to ease the economic burden of the outbreak, including delaying tax day until July 15th and legislation that gives workers paid sick and family medical leave, as well as free testing for those who need it. Trump is also hailing agreements with Canada and Mexico to close their borders with the U.S. As NPR's Windsor Johnston reports, they're closed to non-essential travel as of today.
Department of Homeland Security Secretary Chad Wolf says the restrictions do not apply to lawful trade or commerce and exclude essential commercial activities.
We will continue to maintain a strong and secure economic supply chain across our borders. A few examples of essential travel include, but certainly are not limited to, individuals traveling for medical purposes, to attend educational institutions, for emergency response, public health services.
Wolf says the department is also suspending entry for those who do not have proper travel documentation. The agreement with Mexico is similar to the one announced earlier this week to partially close the U.S. border with Canada. The restrictions at both borders will be reviewed after 30 days. Windsor Johnston, NPR News, Washington.
Vice President Pence says he and his wife are getting tested for the virus after an aide was positive. The economic damage from the coronavirus pandemic is expected to be enormous. But Steve Beckner reports the International Monetary Fund is offering some reason for hope.
The coronavirus is taking a heavy toll as governments suspend normal activities. Martin Muehlheisen, who leads the IMF Strategy, Policy and Review Department, predicts the pandemic's economic impact will be quite severe. But fortunately, he says the world entered this public health crisis in good shape. In the U.S., for instance, an 11-year expansion had brought unemployment to a 50-year low, and Australia had an even longer expansion. What's more, Muehlheisen says banks are stronger than they were before the 2008 financial crisis. But while the global economy is better able to withstand the virus's shock, he says authorities must coordinate in taking further monetary and fiscal measures as needed. For NPR News, I'm Steve Beckner.
This is support for NPR comes from NPR stations.
Fuck! Shit.
Cases that are probably in the community is probably 10 times what we're seeing in terms of what we're reporting.
On Friday, county health officials said a little more than 1,000 tests have been done. If you think you might need a test, officials say to first contact your primary health care provider. All of us are now under Governor Gavin Newsom's stay-at-home order. KPBS reporter Priya Sridhar explains what that means for you.
The order asks most residents to stay at home. Exceptions can be made for trips to the grocery store, gas stations, food banks, convenience stores, banks, and laundromats, and to get takeout and delivery from restaurants. Any trip to a healthcare provider is also okay. San Diego Police Lieutenant Sean Takeuchi says they won't be stopping people and asking them where they're going. It's up to everyone to work together to comply.
I think it takes a social pressure. It takes a community to make sure that we survive this.
Workers whose jobs are considered essential are allowed to go to work.
This is KPBS, San Diego's NPR station where news matters.
KPBS Visual Arts Briefs are supported by the Front Porch Retirement Communities of Carlsbad by the Sea, Casa de Mañana, Frederica Manor, and Wesley Palms, and Fallbrook Art Center, which is closing from March 19th through April 19th. In the meantime,
And this is a really low burden kind of way for me to be with people and help people. I garden a lot, and the garden's about 20 feet from the sidewalk, so if people are walking by and we can chat or we're not together, we're sort of alone together in the nicest possible way. It's when I start thinking about, the world beyond sort of my front fence, that I really get overwhelmed and upset. And so many of my friends and former colleagues are really, really in dire straits right now. The restaurant industry has never seen anything like this. And that's not even me being my typical, hyperbolic self.
Are there some quick word tips that you can give us as someone who is, bright and shining star of food as to how to help the foodies we love in this moment, the food creators.
I think trying to support your local farmers and finding what people who are doing CSA boxes and farm boxes